Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking all about epiglottitis. So let's get into it. The first thing, just a little anatomy review here, the epiglottis, what does it do? It's a little flap that prevents things like food and water from entering down into your lungs. So when you're breathing, it's open, but when you're eating or drinking, swallowing, it closes to prevent aspiration. So epiglottitis happens when the epiglottis gets swollen and then it blocks the airflow to the lungs. Some risk factors for this include being male, having a weakened immune system, and not being vaccinated against some of these infections that could cause it. So let's talk about the causes. So different causes, things like burns, like you drink something that's way too hot and it burns your throat. Swallowing a foreign object, a lot of times children do that. Maybe they put their toys in their mouth and they swallow it. Smoking certain drugs, think like crack, cocaine, that can also cause burns in your throat. And then the biggest, most common cause is infection with influenza B, which is why not being vaccinated against influenza is the biggest risk factor. And how is this spread? Through droplet transmission. A helpful mnemonic device for the symptoms of epiglottitis is air raid, which kind of makes sense, right? Because it involves your airway. So A is for airway inflammation and obstruction. That's what it is, right? That's what's happening. I is for increased pulse. So people with epiglottitis will be tachy, and increased temperature, so they'll have a fever because it's an infection, right? So that makes sense. R is for restlessness. The second R are for retractions. So epiglottitis can occur to anybody at any age, but typically is usually associated with pediatrics, with children. Little ones, infants, when they have a hard time breathing, what they do are something called retractions, which is where they use their abdominal muscles to help them breathe. So when a baby is having retractions, it's a sign that they're having a hard time breathing. A is for anxiety increased, right? Because when you can't breathe, you panic, right? Right? You have that natural reaction. So anxiety increased. Inspiratory stridor. So stridor is what you will hear in the patient with epiglottitis because it is an upper airway obstruction. So when you listen, you might not even need your stethoscope to hear it because usually it's loud enough that you don't. You will hear that kind of like barky seal kind of noises, okay? That's stridor. Usually also associated with children. And then the other two big ones, drooling, excessive drooling, especially in babies, and difficulty swallowing. Or it's painful to swallow, right? Your airway is inflamed, it hurts. So drooling and difficulty swallowing. So how is this diagnosed? The couple of things we might want to do, we might want to take an x-ray to see if there's a foreign object lodged in the throat. They might do a laryngoscopy to visualize the inside to see if there's swelling or inflammation. And then, since the most common cause is an infectious cause, they're likely going to do a throat culture. And once we know what type of cause it is, it will determine how we treat it. For example, a foreign object, we need to remove that, right? An infection needs to be treated with antibiotics. So it depends on what the cause is. So our nursing interventions, number one priority, airway. They need to be breathing because this is an emergency. Think about it. Their airway is obstructed. They can't breathe. So this is a medical emergency. So what are we going to do? We're going to maintain a patent airway, right? That's the priority. We're going to assess their respiratory status, so things like their respiratory rate, their lung sounds. We're going to monitor their vitals. Remember, they can have increased temperature, a fever, increased pulse, tachycardia. We also want to monitor their O2, so keep them in a normal range. If they're not in a normal range on room air, we're going to give them oxygen. Some patients, especially if it's severe, need to be intubated. They're going to be kept in PO until they get better. Some medications we might give them include things like IV fluids, antibiotics, antipyretics, and corticosteroids to decrease the swelling. When it comes to giving that oxygen, we might also give cool mist humidification. We need to have them sit up, so being in like a sitting position as opposed to a supine lying down position is going to be easier for them to breathe. And we want to work on decreasing anxiety. Remember we talked about that in the symptoms. They have increased anxiety because they're panicking because they can't breathe. Well, that panicking is causing everything to get worse. So getting them to calm down, decrease that anxiety, is going to help them breathe better. Now let's talk about complications and prevention. Like we just talked about, this is an emergency, right? So if left untreated, things that could happen: respiratory failure, and then the infection, if caused by an infection, can spread to the entire body. You can become septic. So very scary complications. So we want to make sure that we are recognizing this and treating it appropriately and promptly. So how can this be prevented? So in most cases, this used to happen very frequently because it was caused by the influenza B infection. But now that is a vaccine given during childhood. So it can be given 2, 4, 6, and 12 months. That's the 4-dose cycle. There is another 3-dose cycle where it's just 2, 4, and 12, and the 6 is omitted. So that's going to be specific to your pediatrician. But the best way to prevent it is to make sure your little one gets vaccinated. Some other things you can do: don't share personal items like toothbrushes, cups, silverware. Use proper hand hygiene. Don't smoke anything, cigarettes, crack, anything. Don't smoke. And then be careful with hot liquids because, again, this can be caused by a burn in the throat. And these things can burn the throat. So that was my video. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.